Research has uncovered something many older adults never expect. A pill that helps you fall asleep may also influence the way your brain, balance, and memory function over time. For millions of seniors, sleep medication feels like a simple solution to a frustrating problem. The night becomes quieter, the hours of tossing and turning finally disappear, and waking up exhausted becomes less common. But what happens inside the body after months or years of relying on these medications? And why are some doctors becoming more careful about how long certain sleep medicines are used, especially after age 60? The answer is not as simple as saying sleep medications are good or bad. For some people, these medicines can provide important short-term support. But as we age, our bodies process medications differently. The brain becomes more sensitive, the liver and kidneys may clear substances more slowly, and the effects of combining multiple medications can become more complicated. Today we are uncovering 5 silent risks associated with certain sleep medications after 60. Risks that many people never discuss because the changes can happen gradually. These are not reasons to panic, and they are not reasons to stop any medication without medical guidance. Instead, they are important conversations to have with your healthcare professional, because protecting your sleep is important, but protecting your brain, independence, and quality of life is just as important. And the final risk on this list is something many people overlook completely. For years, sleep researcher and geriatric medicine specialist Dr. Eleanor Matthews has worked with older adults struggling with insomnia, nighttime anxiety, and medication concerns. With more than 25 years of experience caring for senior patients, her research has focused on healthy aging, brain function, and how everyday treatments interact with the aging body. She often explains that sleep is one of the foundations of health. Sleep is when the body repairs itself, the brain organizes memories, and many important systems reset, she says. But the goal should always be healthy sleep, not simply sedation. Imagine a 72-year-old man named Robert. After retiring, Robert began having trouble sleeping. He would lie awake for hours thinking about his health, his future, and the changes that came with aging. His doctor prescribed a sleep medication, and at first, Robert felt like he had his evenings back. He slept faster. He woke up feeling better. He believed the problem was solved. But several months later, his wife noticed small changes. Robert seemed slightly slower in the mornings. He felt less confident walking downstairs. Occasionally, he struggled to remember simple details that had never bothered him before. These changes were subtle, nothing dramatic, nothing that immediately looked like a medical emergency. And that is exactly why these risks are often missed. Let's begin with the first hidden concern. Number 5. Changes in balance and fall risk. One of the biggest concerns doctors monitor in older adults taking certain sleep medications is their effect on balance and coordination. Many sleep medicines work by slowing activity in the nervous system. This calming effect can help people relax and fall asleep, but the same effect may continue into the following morning. For a younger person, the body may recover quickly. For an older adult, the story can be different. Age-related changes in muscle strength, vision, reaction time, and balance already make staying steady more challenging. When a medication adds extra sedation or slows reaction speed, the risk of losing balance may increase. Dr. Matthews explains that many falls do not happen because of one single problem. They often occur because several small factors combine. A person may wake up during the night to use the bathroom. They may be in a dark room. Their muscles may be stiff from sitting or sleeping. Their blood pressure may shift when they stand. Add a medication that affects alertness, and a simple moment can become risky. Consider Margaret, a 68-year-old woman who loved gardening. She had always been active and independent. After starting a sleep medication, she noticed she felt slightly unsteady when getting out of bed. At first, she ignored it. She thought, "This is just part of getting older." But after discussing it with her doctor, she reviewed her medication routine, adjusted her nighttime habits, and focused on improving strength and balance exercises. Over time, she became more confident again. The lesson is not that every person taking sleep medication will experience falls. The lesson is that after 60, small changes deserve attention. And the next risk involves something even more closely connected to independence. your brain. Number 4. Memory and thinking changes. Many older adults worry about memory. They forget where they placed their keys. They walk into a room and forget why they entered. They struggle to remember names that once came easily. These moments are common with aging, but when certain medications are involved, doctors often look more closely. Some sleep medications affect brain chemicals involved in calming the nervous system. Because of this, some studies have found associations between long-term use of certain sedative medications and problems involving memory, attention, or thinking ability. The important word here is association. Research does not mean every person who uses a sleep medication will develop memory problems. Aging, health conditions, genetics, lifestyle, and many other factors influence brain health. But scientists are interested because the brain changes as we grow older. The same dose that affected a person at age 45 may affect them differently at age 75. Dr. Matthews describes the aging brain like a sensitive instrument. It is not weaker, she explains. It is simply different. It may respond more strongly to substances that influence brain activity. Some seniors notice signs such as feeling mentally foggy in the morning, having difficulty concentrating, or feeling slower when making decisions. These symptoms should not automatically be blamed on medication, but they are worth discussing. Because sometimes the solution is not removing a medication completely. Sometimes it involves adjusting timing, reviewing other medications, improving sleep habits, or finding the safest approach for that individual. And the next concern reveals why medication combinations matter so much after 60. Number 3. The hidden problem of multiple medications. Many older adults take several medications every day. One pill for blood pressure, another for cholesterol, another for pain, perhaps vitamins or supplements, and sometimes something to help with sleep. Each medication may have a purpose. The challenge appears when multiple substances interact inside the body. Doctors call this polypharmacy, the use of multiple medications at the same time. It is common among older adults because health needs often become more complex with age. The concern is not that multiple medications are automatically dangerous. The concern is that every additional medication creates another possibility for interaction. A sleep medication combined with other medicines that affect the nervous system may increase feelings of tiredness, confusion, or reduced alertness in some individuals. This is why medication reviews become increasingly important as people get older. A woman named Linda, age 76, discovered this during a routine appointment. She had been feeling tired throughout the day and assumed it was normal aging. But when her doctor reviewed her full medication list, including prescriptions from different specialists, they discovered that several medications could contribute to daytime sleepiness. After a careful conversation with her healthcare team, changes were made to her treatment plan. She did not simply stop everything. She did not ignore the problem. She created a safer strategy. This is an important reminder. Your medication list is not something to memorize and forget. It is something to regularly review, because the next risk involves a problem many people mistake for successful treatment. Number 2, dependence and reduced natural sleep. Ability sleep medications can sometimes create a difficult cycle. A person struggles with sleep. They use medication. They sleep better. Over time, they begin to feel that sleep is impossible without the medication. This emotional dependence can become powerful. Sleep is deeply connected to our sense of security. When someone believes, "I cannot sleep without this pill," anxiety around bedtime can increase, and anxiety itself can make sleeping harder. Some medications may also become less effective over time as the body adapts. This can lead some people to feel they need continued use or adjustments. Again, this does not mean everyone using sleep medication becomes dependent. Many people use these medications responsibly under medical supervision. But it does mean that long-term sleep problems should be approached from multiple angles. Because the goal is not just to make someone unconscious for several hours. The goal is restorative sleep. Healthy sleep comes from many factors: a consistent bedtime, morning sunlight exposure, physical activity, managing stress, a comfortable sleep environment, addressing underlying issues that may disturb sleep. For example, Robert, the man we met earlier, eventually learned that his sleep struggles were connected partly to anxiety after retirement. His medication helped temporarily, but improving his daily routine, exercising, reconnecting socially and working with his healthcare provider created a more complete solution. He did not just chase sleep, he rebuilt the conditions that allowed sleep to return naturally. And now we arrive at the final risk, the one many people overlook because it does not always appear immediately. Number 1, losing the body's natural connection between sleep and health. The biggest hidden issue may not be the medication itself. It may be what gets ignored because the medication appears to solve the problem. Poor sleep in older adults can sometimes be a signal of something deeper. Sleep difficulties may be connected with stress, depression, pain, medication side effects, breathing problems during sleep, changes in routine, or other health concerns. When a pill becomes the only solution, the original cause of the sleep problem may remain hidden. Think about a warning light on a car dashboard. You can cover the light with tape, but the engine problem still exists. Sleep can work the same way. A medication may reduce the symptom, but understanding why sleep became difficult in the first place is often the most important step. Research continues to show that healthy sleep is connected with brain function, immune health, emotional balance, and overall well-being. This is why many healthcare professionals focus on what they call a comprehensive sleep approach. Instead of asking only, "What pill can help me sleep?" they also ask, "What is affecting my sleep? Are there habits we can improve? Are there medical causes we should investigate? What approach gives this person the best quality of life?" Because aging well is not about simply adding more years. It is about protecting the years you have. It is about waking up with confidence, walking without fear, remembering important moments, spending time with family, and maintaining independence for as long as possible. So what should you do if you take sleep medication? First, do not stop suddenly unless instructed by your healthcare professional. Some medications require careful management. Instead, consider having an open conversation. Ask, "Is this medication still the best option for me? Are there any long-term concerns I should know about? Could my other medications affect my sleep or alertness? Are there lifestyle changes that could improve my sleep?" These conversations are not about fear. They are about being informed. Your health decisions should always be personalized because every person's body, medical history, and situation are different. Sleep is one of the greatest tools we have for healthy aging, and protecting that sleep requires more than counting hours in bed. It requires understanding the relationship between your brain, your body, your medications, and your daily habits. The good news is that aging does not mean losing control. Small changes can create meaningful improvements: a safer nighttime routine, more movement during the day, better communication with healthcare providers, a stronger focus on overall wellness. These steps can help support better sleep and a healthier future. If you are comfortable sharing, tell us in the comments. How old are you? Have you ever struggled with sleep after age 60? And what has helped you sleep better naturally? Your experience may help another person who is facing the same challenge. And in our next health documentary, we will explore another important question many seniors ask. Why do some people stay strong and energetic into their 80s, while others struggle with weakness much earlier? The answer may surprise you.